Good afternoon and welcome everyone. In today's workshop, we will discuss how companies can attract and retain female talent by developing and offering a competitive benefits package that not only involves fundamental components of women's well-being, including mental health, family needs, and financial wellness, but one that also addresses critical gender, racial, ethnic, and other social disparities experienced in our society today. It is my pleasure to extend a warm welcome to our speakers, Mariya, Konovalova, Principal Global Consulting, Tri-State Racial and Ethnic Diversity Business Resource Group Co-Chair at Mercer, and Diego Ramírez, Partner, Global Consulting, Global Health and Inclusive Benefits Advisor at Mercer. I would also like to thank our WHN lead sponsors, Goldman Sachs and Organon & Co., for their continued support. I would like to remind everyone that this conversation will be recorded and published on our website for later viewing. There is simultaneous interpretation in Spanish available in this session, which you can access by clicking on the small globe icon that says Interpretation in the toolbar below and clicking on the Spanish option. Today, we will begin with a presentation from Mariya and Diego, and then we will open the floor up for questions and answers. So please prepare them. As this is an interactive workshop, we ask that you please virtually raise your hand to ask a question, and once called on, please turn on your microphones and cameras to ask the question. Without further ado, Mariya and Diego, the floor is yours. Thank you.
Thank you, Randy. So welcome everybody. Thank you so much for joining to spend this hour with us. Our presentation is around a holistic approach to gender equity in company benefits. So in terms of our agenda, as Randy mentioned, we'll introduce ourselves briefly. We'll cover what that means, the holistic approach to gender and overall diverse workforce health, and talk about some potential solutions. And then we'll leave about 20 minutes or so for question and answer and open discussion. Diego, do you want to introduce yourself to start?
Thank you. So thank you everyone for being here. My name is Diego Ramírez. I'm based in New York. I have been working for 20 years supporting clients to design benefits. My background is clinical as a doctor of medicine. In the past almost 10 years, I have been devoted to develop health and equity, working especially with global clients and with a specific role for Latin America for 8 years. So I hope we can have a great conversation today and transfer part of these lessons learned during this journey working at Mercer.
Thanks, Diego. Yeah, I'll introduce myself. I am also at Mercer, a principal in our global consulting practice based in New York, and have been working for about 15 years on various global issues. The last couple of years on the subject of global inclusive benefits, working closely with Diego. I'm excited to talk about what we've learned in the market to you all today. Right, so we'll just jump right in. Why are we here? This is a primarily women's organization. I know we have men on the line as well, but I think we all want to aspire to gender equity, but women face significant disparities in the workplace. And it's not just about the much talked about gender gap in pay. There are other disparities and other barriers for women at work. We have seen this exacerbated by the COVID pandemic. So we'll talk a little bit about some of the facts, but we see that even in recovery, although, we'll see if the recovery continues, but we've seen a setback for women during COVID and in coming back from COVID. It has disproportionately affected minorities, and especially Latino women, as you can see by some of the factoids here. We also see the workplace is changing, and some of it is going to be affected further. So You'll see an example here that women are currently in our latest research are showing they're not happy in the workplace. They don't feel like they're thriving. So what we want to talk about today is how we can get them to that thriving point. In general, the workplace has changed in the last decades, right? So we see workforces are increasingly more diverse, and so our employees' expectations and needs. Before, at least in the perception of what the workforce looked like, you've had kind of a linear progression, right? Like you go to school, you go to the workforce, or you go to education and then to the workforce, you get married, you have children, then you retire. And it's become a little different as more different, diverse people have entered the workforce as our lives have changed. So you will have a bunch of different generations working together. You will have more women represented in the workplace. You will have single people, married people with children, single people with children, etc. People of color have different needs. People of different sexual minority orientations have different needs. You have the sandwich generation that's caring for their parents while caring for their children that they had later. So you're seeing at very many touch points and very many different needs that employees have, and the expectation on the employer has risen as well, that you're finding solutions for those needs in the workplace, both in terms of the work you do, your schedule, essentially what we would see as HR policies and programs, and your benefits that are provided. And that is a global trend. It is not a US specific trend, although the percentages here you see are US specific. So essentially, traditional benefits aren't designed for this. If we think about how benefit programs came into being, they were designed decades ago to support the workplace in place then. So what was that? That was primarily male and primarily dominated by whatever ethnicity was prevalent in the country. In the US, that would be white men, and kind of that traditional situation where at the time the man was in the workplace, the wife stayed at home, raised the children, and so that's what we looked at. And then as workforce changed, there have been introductions of different benefits to kind of put a stopgap on emerging needs, but not really a consistent way. So companies look to each other in the market to measure against each other, and not really looking at the needs of their employees. So we take a different approach that Diego is going to talk about, a way to look at what are the needs of the workplace instead of just continuing the same thing against the market.
Thank you, Mariya. So what we have seen in the past 10 years with a higher participation of women in the workforce, and considering that probably at the global level, before the pandemic, we were amongst the 40%. We know that there is an impact because of the pandemic in the global workforce of women. But definitely the benefits that were offered by the companies in the past were not really meeting the needs and the events that women experience during the lifetime, especially now, and with different roles in the society, in the workplace. In that sense, we definitely consider that after the pandemic, and because all these changes that we have experienced also, it is necessary to develop benefits that are more focused and more targeted to the different groups, including women. It is important also to provide equity. In the case of the US, in some way, we have an advantage with the ACA because, defines the essentials, defines also the coverage of existing conditions, and is, in general terms, after the reform, has a broad spectrum of coverage, even for women's care. But if we think outside the US, and we think about countries in Latin America, Central America, South America, we start to see still disparities related to women's care. It is not yet a surprise that in some countries like Mexico, prenatal care is not covered under the standard plans because it is considered something preventive, and the medical plan only covers medical conditions with diagnosis. or it is interesting to see that a lot of screenings provided in some countries in Panama, Central America, are considered preventative, and they are not part of the diagnosis of the claim to be covered. In terms of equality and level of benefits, part of the work that the organizations are doing as a mega trend is also to look what they want to offer to their employees at the global level and how they want to reduce the disparities, no matter the geography, country, or local market practices. One of the big challenges and that we are doing for the system is to really think in the needs and the health of individuals, and not just in what are the capabilities of the carriers, of the vendors, of what other companies are doing. It's really what makes sense for your employees and your workforce and your women. Finally, companies are working strongly nowadays in a more targeted communications to provide better access to the benefits offered and under the lens of the needs of everyone. And finally, we have also an important element, which is the data analytics. This is a great advantage that most of the demographics have gender. So definitely we have a great opportunity to continue digging on data to understand how benefits are really matching with the the needs, the expectations, and how they are really supporting women in order to thrive in the organizations in their lives. So this is the mega trends that we are managing currently when we think about inclusive benefits, when we think about the lens of gender and the lens of needs of specific groups. So next, please. So saying that, basically what we are looking for with the benefits is to address, inclusive benefits to address the gaps and disparities that exist in terms of healthcare, well-being, and financial protection. We are, completely convinced, and we have important organizations moving on this journey, also in alignment with their ESG strategies, to provide equal access opportunities in terms of care, in terms of development of career, in terms of thriving in the society for women. That's a great commitment that we have. The organizations that we are working with are moving ahead and are doing, and definitely it requires really to break the ground and really think about it, the strategy, and then think how that will be possible and how it may will be developed. I want to be clear here that it requires resources, it requires investment, but at the end it will be worth, and we are going to talk about that during this session as well. So considering benefits, and just to try to narrow the conversation today, because we can have a lot of elements on the total rewards concept. In terms of benefits, we define in general terms 4 dimensions. Thrive not means only in terms of financial or only socially. It also implies to be physically well and emotionally well. And we are, we prepared this conversation today under this lens, addressing these 4 dimensions when we talk about well-being and benefits that support well-being and women to thrive. So in the next slide, let me start with the physical well-being. We know that you can start to make questions, but let me start here with the physical well-being. In general terms, it is applicable for the US and globally. During the pandemic, we have seen a delay in the access to care. Now we have a big issue because thousands of surgeries were delayed. And we have seen also that an important amount of women have waived their screenings and their annual checkups during the pandemic. And I'm talking about basic things like the pap smear and mammograms. So this is one point, and particularly people with chronic conditions in general terms felt during the pandemic that they became worse, they feel worse. Another point is how the component of gender impact the medical care. And for example, we have here that 80% of the autoimmune diseases happen on women. And when we think about the treatment for autoimmune diseases, we are talking about a long-term process, usually with high-tech medicines that are not commonly covered in many countries in Latin America. When we think about also about women when they are facing pain, women and it's not my point of view, it's based on data and evidence-based information, are more stoic when we talk about pain. And that makes that women also are more, vulnerable and will have a higher likelihood to suffer a second heart attack compared to men. And finally, it is important to keep the lens of the intersectionality. So here, for example, we can say that Hispanic women and Black women in the US still have a higher rates of complications and higher rates of newborn deaths, despite the ACA is providing the care and despite the reform that we have currently in the US. So what are companies doing in terms of opportunities to address these gaps? And this is some examples. I mean, there are more information, but we try to keep here in a very high level. So what companies are now considering to address during through the inclusive benefits includes enhance the preventative care, enhance the benefits for reproductive health. Particularly, we are facing, and not only in the US, we have been facing an important polarization in terms of abortion around the world, and how women will be getting access to these type of benefits. We have seen some companies in the US providing travel and lodging benefits in order to avoid states where they cannot conduct an abortion. But this situation is also happening, especially in Latin America. We still have important gaps and and stigma and taboo regarding this point. Another point that is very important nowadays is family planning in terms of providing fertility care services or even for provide adoption and surrogacy benefits. And when we talk about more basic things, we still, as I mentioned at the beginning, Mexico, Panama, and some countries in Latin America still have gaps in terms of women-specific conditions like pregnancy care, postnatal care, menopause, that are not covered because they are considered physiological status of women and it's not a disease. That's the reality sometimes of the posture of the systems to exclude this type of benefits. We have also an important element in Europe, which is not not the audience today, but in Europe we have seen a strong component around menopause because of the aging women population requiring more support, even in the workplace, with the special spaces and supporting them with a more tranquil and silent spaces for making them feel better. And we have also for women's care in terms of physical health, new technologies like genetic testing that will help to make an early risk assessment about breast cancer. And interestingly, still a gap in this type of benefits in general in the medical plans. Experimental treatments and a broader coverage for breast cancer is still a challenge. And that's why Mariya was doing the comment. If we go through the markets in general terms, lung cancer, that was the main reason of death in men during the past century, is plenty covered. And in general terms, prostate cancer is plenty covered. But when we go through the coverage for breast cancer or cervical cancer, we start to find little, components like limited to this sublimit amount or limited to one time per lifetime or have a sublimit in the coverage. I'm talking in general about Latin America. I know that this is not the case in the US, but we still are facing this kind of things. In terms of breast cancer, for example, in the US, we have a very particular situation with the mammograms. The protocols define that mammograms will be provided for women after 50 years old, but the reality is that Black women in the US used to start to suffer cancer in an early age, around the 40 years old. And there is some relationship between hair relaxers, heavy hair relaxers users and breast cancer in Black women. So all these elements are adding and required to be reviewed, and companies are really moving on this journey to create the right benefits and match with the real needs of women. Finally, in terms of flexibility, leaves, and fitness support are elements that are also provided to women. Mariya will be talking more on flexibility and leaves and also social well-being. So this is basically what I wanted to share, what is happening now in terms of women's health, the physical dimension. I would like to pause here to see if there is any comment or question. I know that we have the chat as well as an option.
We do have a chat, but everybody's very, very, very shy today. I have a question if you'd like to answer a question, otherwise continue.
Yeah, sure.
I love the way the 4 boxes fill together, particularly when you have emotional and social well-being, which people don't really focus on how important that is. But after the pandemic, we certainly appreciate having that type of coverage. Your 2020 report states that 81% of employers are focused on improving diversity, equity, and inclusion, but only 38% of businesses actually have a multi-year strategy in place to achieve this. Why are companies not being more intentional with implementing multi-year strategies to improve DEI? And aside from it being a moral imperative, what incentives are there for companies to implement these strategies to promote DEI?
Yeah. I would say that the first barrier is still a bias, the process of investing, putting the resources, align the business strategy with the D&I strategy, and finally align the DE&I strategy with the benefits. So obviously all this approach requires important commitment, investment, and resources to make this happen. So it is interesting and I have this conversation sometimes with companies that are saying, show me the ROI, show me the numbers to see the results. But we can demonstrate, and it is already plenty demonstrated by data, is, inclusive companies have a higher performance financially talking. But this is a process that requires years, and it's a process that requires a commitment in the long term. The second point is that having a more inclusive environment make people and individuals more productive, more engaged, more innovative. Because at the end, when you invest on DE&I, you are not only connecting with your employees, you are connecting with your, with their families, you are connecting with the communities, you are connecting with the vendors, and you are connecting with the investors and the societies where you are developing these strategies. So we know that this is, this is not a result that an organization will have in one day, 1 year even. But the challenge, Randy, is that organizations need to invest first. I think that a good point, derived from the unfortunate pandemic, is that disparities became more and more evident. This is one point. The second point is that organizations learned that definitely they need to get committed to the ESG strategy. They need to keep going with the gear in the right way in terms of sustainability, and not lose the vision because they were in a crisis during the pandemic, or because now we are concerned about a potential recession, and lose the gear and lose the investment in elements that are critical for the long-term success of organizations. So I hope I can respond to your question, Randy, and the rest of the participants.
We have 2 more questions. Nikos Liutas, do you want to turn your camera on and ask your question? Nikos?
Sure.
Sure thing. So I sit in a global role, and we often see a lot of benefits in general, women's health benefits, starting in the US and then starting to trickle through other countries, same with specific sectors. So I was just curious, from your perspective, where do you see the leaders, either from a regional or an industry perspective, and then how soon do others tend to follow in regards to this? Okay, perfect. It's a very good question. The highest development has been in the high-tech sector. This is the companies that are pioneering on this type of benefits. Then we have the financial sector moving on this journey. The third sector that I have in my experience working with them is the professional services. That means consulting, that means services organizations. And then I wonder, and we expect that retail companies will be moving more as a followers, and other business like mining and agricultural businesses will be
following in 3-5 years what other pioneers in big players will be developing now. I think it is important to say that most of the organizations nowadays, one of the talent that they need is a talent that has, digital and analytics and basically high-tech profile. So when I am talking with a retail company nowadays, they are looking for a more digital, strategy. And in that case, they are ending up competing against high-tech sector. It's the same situation with the financial sector. Financial sector now is competing against high-tech for talent. So, saying that one company or one sector would like to be a follower or a pioneer will depend on the business and talent strategy that the organization have, and at what extent they want really to get the right talent in the next 3-5 years instead of waiting for becoming a follower of market practices. Yeah.
And anything as well from a geographic perspective beyond the US?
Absolutely. We have seen important efforts of organizations in the high-tech sector to address multi-country, especially, obviously they are prioritizing the big markets. So Brazil, Mexico, Colombia, Panama are within, our strategies. Argentina, but Argentina has a very generous medical plan, but there are some issues that could be addressed as well. And countries like Chile, are countries with a very strong and regulated healthcare system that makes harder to provide some type of benefits. But I can tell you that main geographies are now under the lens, and also clients and companies are prioritizing countries with a higher disparities. And Mexico is a very good example in terms of disparities for women and in terms of gender. So,
yeah, I just want to add that also, I know it's not just physical health, but I think we see some governments kind of starting to address these issues, like these disparities, right? And in terms of medical, it's mostly out of Europe other than the US, but you see other benefits, right? The leaves mentioned around pregnancy loss, ensuring there's maternity complications, leaves, et cetera. And that's happening for a lot of governments in Latin America as well.
Thank you so much.
So I know we have more slides. Shall we continue and hold the next batch of questions until we're further along the presentation? And Rafa, I know you've got a question, so you're first. Go ahead.
Perfect. Thank you, Randy. So when we talk about emotional and mental health, it is important also to, we are bringing some statistics. Women are twice more likely to suffer from mental health conditions during their life. I want to be very clear here in this statement. It's not an intrinsic matter. It's an extrinsic matter. That means women are exposed in a long-term stress, discrimination, harassment that make them more vulnerable to suffer from mental health conditions. If we remove that variables, the intrinsic likelihood is the same that men. So I want to be very careful with this statement because it's a matter related to external factors and long-term exposure to stress, microaggressions, discrimination, harassment that make them more vulnerable to suffer from mental health conditions. We have also, in terms of, the pandemic, practically anxiety and depression triple in the US. And this is data that we can utilize as a reference for the rest of the world. As well, for women, the impact of the pandemic have been higher, the negative impact, than men. In terms of mental health, 46% of women said that it was negative, instead of men that they said 33% were a negative impact. And also we can all go deeper in elements like, domestic violence. And domestic violence has also some intersectionality with other components of women. For example, when we talk in general terms around the world, 1 in 3 women experience any kind of domestic violence during their lifetime. This is data from the United Nations. It is higher in some markets like Mexico, for example, with a higher, unfortunate prevalence of feminicides. But when we go deeper on the domestic violence, we can see, for example, that 55% of heterosexual women experience any kind of violence, 44% of lesbian women, and 61% of bisexual women experience any kind of rape, physical violence, or stalking. So the point here is that we need to consider also how the intersectionality within the women, it is important to mention that this intersectionality has also an element that needs to be addressed when we are developing strategies for mental health and mental health and emotional well-being. Finally, this is data from the US. Drinking, alcohol drinking increased 17% by women. That means 41% higher than the baseline in the heavy drinking women after the pandemic. So definitely also alcohol consumption has been increased because of the pandemic. This is data from the US. But at the end, we need to consider all these elements when we are thinking in the type of benefits that organization needs to provide. Again, here, when we think about and consider benefits, we are talking about working more on the preventative components of connectedness, socialization, coaching, improve the mental health medical coverage. The EAP is a solution, but it's not enough, and it is necessary to have access to mental health care. We are talking about inpatient, outpatient medical care. We are talking about drugs and substances abuse, eating disorders that are mainly expressed in women, or at least seeking for medical care. In the case of women, 90% of the cases of eating disorders are happening in women. And it's not a surprise that in most of the countries in Latin America, mental health has a blanket exclusion in the medical plans. So, or there are slight coverage in some countries like Mexico under the traditional plans that are only, 8 sessions for in case of rape, terminal ill, or in case of kidnapping. But this is really not the needs and the type of benefit that individuals need when they want to address mental health and emotional well-being. We also have seen, important work in regards to education and empowering women about domestic violence support, not only at the workplace, but also let them know the resources available in the community and the mental health support for those women to move ahead. We have talking also about postpartum care, which is not covered in many countries. And depression, postpartum depression is typically not covered under the exclusions of mental health. And we consider also that it's important to address and to cover, importantly, the stigma, other programs such as suicide, and programs like the, Vendors Navigator. It is important to say when we talk about mental health, it's not the same as we talk about physical health. I'm thinking here in a pragmatic way, but if you have a chest pain, you go to the emergency room, you have a cardiologist, and you just want to save your life. But when you are talking about mental health and you start to look for a therapy and match with a professional, it is necessary to have a different connection with this individual. It is necessary to have a connection in terms of representation, gender, culture, background, in order to really make the connection that you need for your psychological process healing. So we have seen also an important number of organizations providing this type of solutions for helping individuals to match with their mental health professional, and also requiring to the carriers and vendors to have a better representation in terms of gender and in terms of minorities like Hispanic or Black individuals as part of the healthcare in order to support individuals and connect better with their needs. So I like to pause here. This is the component of emotional and mental health well-being. And I will hand out to Mariya to talk about social and financial well-being.
Thanks, Diego. So, as we mentioned, and I think we saw in the comments, some of these are overlooked sometimes, starting with emotional and through financial and social. We all have heard about the gender pay gap, but there's a lot more to it than just that, right? So when we think of it just within the healthcare keeping with the healthcare conversation, women end up actually 80% of healthcare decisions and purchases are made by women because of the caregiving role that women take on often. But that women earn about, this is the US average, 24% less. They have lower savings and retirement savings and have longer life expectancy. So essentially they are spending more on healthcare for themselves and their children, maybe other people in their household they're caregiving for. And in the meantime, they have less income and they have a longer life expectancy to spend that money on. So there's a lot of strain on women. And then, some statistics here around Hispanic households. So again, this is US figures, but obviously the gap for women is global. In the US, Hispanic women have kind of been hit the hardest even before the pandemic, and then the pandemic exacerbated that. So employment for Hispanic women is 50% higher than of white women, and it's actually surged very much during the pandemic. They were the hardest hit. A lot of women left the workforce, and some have not been able to come back. The industries that are the hardest hit by COVID were also the most prevalent for women to be employed by. And we have this additional information around kind of Hispanic households and their participation in workplace retirement plans are tens of percent, lower than the general population. So the general population is closer to about half participating in retirement plans. The Hispanic households are only 31% have a retirement plan access. These are just some examples, but you will find this is a prevalent issue for women. So what are some areas of opportunity there for employers to consider and for you to think about for yourself? One is, of course, the pay gap. So there are now pay reporting requirements in some countries, and there are a lot of companies that are making an effort to close for pay equity and to close their gaps based on their ESG principles. And then ensuring that benefits cover not only people who are full-time regular employees, but also part-time employees hourly instead of salaried. These are more likely to be women. Women are more likely to not be working full-time. So they're the hardest hit when the benefits or leaves policies only cover full-time people. Retirement contributions around leave. So there's a lot here on leaves. And that is because women are more likely to take that caretaking role. They're more likely to take a longer parental leave or even a career break. So we want to ensure equity there with retirement contributions that are continuing during leave, benefits that are continuing during leave, and also taking into account any incentive of variable pay. So if somebody works on commission and they go on a paid leave, if that paid leave doesn't include that variable pay, their income is significantly reduced. So they're either forced to come back to the workplace or drop out of the workplace. And then allowing for catch-up contributions, voluntary catch-up contributions into retirement plans for those who do stay out of the workforce for a longer time, for a career break. Allowing for an early withdrawal from retirement funds, or in Latin America, there's a lot of practice of company loans for emergency expenses, basically creating a financial net for women. And then ensuring they're equipped to manage finances. So financial literacy and education is provided at a lesser rate for women, lesser for minorities. Again, this is a US figure, but for ethnic minorities, right? So Hispanic women are the biggest disadvantage for this. And ensuring that the employer provides some sort of support around education, and not just the, if you talk, even within our company, and we work with this, if we talk about understanding the 401k plan, there's not a lot of it, right? And so making sure you're not just offering programs, but actually supporting the people making their decisions. Again, people who grew up in immigrant households, people who are immigrants themselves are finding that especially difficult to navigate, even if they they're well educated and have the background. It might just not be suitable to whatever country, and there's a lot of mobility within Latin America, not only the US. And then continuing to think about different retirement offerings, so removing vesting requirements so that the new generation of people who change jobs more frequently are able to secure a retirement savings. Looking at more ethical investment vehicles. Again, this is something that actually we see matters more for women, and also goes towards the flexibility of choice for employees. And finally, Diego pointed out some exclusions in medical plans around women's health conditions. There are also life and other risk policy exclusions around that. So ensuring that you have those conditions covered, and also ensuring your short and long-term disability coverage applies for conditions that are that women face. And then this is probably the biggest area, but it's not what we're focusing on today, and that's ensuring your hiring promotion practices support women moving up in the workforce and staying at a company to have the opportunities for promotion. So that's this could be a separate long discussions around finance, but this is a bird's eye view of it. And then social is another area that's often overlooked or kind of pigeonholed into, like, just put into other areas. But what we see is, again, related to caregiving. We see that on average in the US, women take 12 years out of the workforce. Now that's an average. Some of these women don't return to the workforce, and that goes into that average, but women are much more likely to be out for a longer period caregiving. We also see that domestic work burden for women is much higher than men, so that goes into the social well-being, emotional well-being, and financial well-being. So they are contributing about 4 hours of unpaid work in the home versus under 2 hours for men. We see that globally women also volunteer more, so this goes into the social well-being part. So what should companies be looking at? So the key one is family leave, and I think for a long time people were talking parental leave only, but as we see all the other caregiving duties that women face, it's parental family care and bereavement leave. And just to be clear here, this is not just leave for women. This is leave for everybody, because obviously if men are able when encouraged to take a longer leave, that reduces the domestic work burden on the woman and allows her to stay more in the workplace. Support around return to work, this is something we see is very effective. Many women who return to the workplace, and men who return to the workplace from a longer parental leave break find it difficult to readjust. Some end up leaving the workforce. So having that opportunity to ease in, it could be a reduced schedule, it could be coaching support, it could be just training your managers to work more effectively with people who are kind of trying to find their way back in. This we see is effective, and there's no clear data, but anecdotally, we've seen companies reduce their attrition highly for people who have just returned from parental leave by introducing these types of policies. Supporting breastfeeding, so allowing for breaks and for lactation rooms in the offices. Child care leave and support, so providing backup child care, allowing for leave for child care, not just for illnesses, but for other events like school meetings and activities. Ensuring your leadership and managers are trained and understand what those additional burdens on women are. Providing support through social and volunteer activities through BRGs, and then ensuring to help ensure women move through and up in the company, mentorship and sponsorship programs. Sponsorship particularly is an effective way, kind of a more formal way to ensure people are supported. And then children's care in the medical plan overall flexibility in terms of work, schedules, approach, kind of empowering managers to make decisions to better their employees, and a general commitment to diversity, equity, inclusion are important. Yep. So this is, again, a bird's eye view. And one more very quick point to make is we mentioned some facts for Hispanic women, but there's a lot of evidence of intersectionality kind of increasing the burden. So for Afro-Latinas, for sexual minority women who are Hispanic, the burden is even higher. That's just something to always think about when you think about issues are facing. We don't want to always put people in buckets. There are more categories that everybody meets. Right. So I know we're nearing our time for the talking portion of this. So maybe we can take some questions now.
Absolutely. And thank you for that wonderful roadmap, because you hit on so many of the topics that we discuss in our Women's Hemispheric Network. And it's great to remind us. I know Rafa's been holding his tongue, but his hand is raised, so you can always count on Rafa to ask a question.
Oh, yeah.
Rafa,
Oh,
and
yes.
then I'm going to call on Laura Beristain, so prepare yourself. Rafa.
Thank you, Randy, and also to our speakers. I think for this cascade of information, it really shook my ideas. So Diego, I'm gonna probably refer to a couple of very practical points, right? So the health of women is becoming a hot topic, if you wish, right? In many different circles, which I like and I applaud. At the same time, and we're talking about this specific topic on benefits, people do not necessarily know how to put their arms around the wealth of potential initiatives or benefits that a company needs to take into account. So my question and hopefully my request is, you mentioned that companies from high tech and financial and consulting services are making progress. This group right here will really benefit from learning a little bit more about the details behind some of those benefit programs. What are they including? What type of functions in the companies are involved in the conversations to be able to put them together? What are the critical questions that a company needs to ask to be able to move this conversation forward? That's one. And then my second piece, a request, I would love your thoughts on both, is about quantifying the impact. So you said it very clearly. As soon as companies really understand how much they will gain in talent retention, in less turnover, in economic growth, actually, as soon as they get that on how it's impacting its ESG program, as you mentioned, as soon as they are able to quantify and qualify some of those returns, then the investment will be clearer. So we'll love your thoughts on those two. And if you have any information that you can share with this whole group, we'll all be thankful, very thankful about it. So back to you.
Yeah, perfect. That's good. So in terms of pragmatic benefits to be developed, and our recommendation to the companies to do the approach is, first of all, is understand what is the baseline in the countries, what is happening in the benefits, what kind of benefits they are offering. And obviously the analysis that we do and the analysis that company needs to do shall be under the lens of DE&I, or under the lens of women's needs. The problem, Rafa, is that And I have been doing that for years. I mean, I have been working on benchmarking for years and helping companies to understand what other companies were doing. But the problem of the benchmarking is that the benchmarking perpetuates the disparities. The benchmarking has a blind spot that is following the practices but not understanding the needs of minorities or the needs of women, because this is the market practice for a mainly male workforce. And this is what the insurers, this is what the employers need to cover. And my point of view is to not follow this benchmarking, is more think what I need to address in my strategy in terms of workforce. What is the participation and representation that I want to have of women in 5-10 years? How the benefits will be helping me to hire and retain women and help them to develop their career. I don't think that the solution for helping women and families to develop a family is delay the childbearing. This is a very personal point of view, but I don't think that women should freeze the eggs and wait until they become 35 years old to have a successful career. I think that women needs to have the support during the right time for getting pregnant, for having the return to work, for having the leaves, and that should not affect their career development. But this is something really structural, and this is something, a bias that exists in the system that is not easy to be addressed, Rafa. Usually my conversations, when we are starting to talk about these topics with the benefits team, end up with the senior leaders and the executive leadership. This is something that needs to have the backup and the support from the executive leadership, because these strategies implies financial investment, implies DE&I leadership, implies benefits team, implies operations, and implies legal. When we do the baseline analysis, Rafa, we also include and we review local data and regulations, because we cannot offer surrogacy now in Mexico because it's not possible because of the regulations. It is possible in Brazil under a 4 level of family relative to get altruistic and voluntary surrogacy. But the point is that we cannot also, as an organization, go through the markets and say, we are going to cover reproductive health, we are going to cover abortion. This is something that is necessary to be conducted in order to understand local regulations, local sociocultural aspects, local practices, local healthcare system, and local vendors' capabilities. And once you have this baseline and you understand how this baseline really match or not with your needs, you can have a picture about what is the situation in the country. And what we do is create a framework that will be applicable at the global level, which is the global minimum standards or global standards of care, which is a reference by the company to be utilized in order to implement this benefit at the regional and the local level. But they will have the opportunity to tackle and to calibrate according to the reality of the market. These global minimum standards have also a global guiding principles that define, and it will depend on the company, it will depend on the company appetite, timeline, budget, resources, operational capacity. And I have companies who want to work on this and develop this in 3 to 5 years. I have other companies that are saying that they are going to do in a period of 5 to 7 years. And I mean, there are good examples of companies working on this for more than 20 years. IBM is a good example that they have been working from this since 2000, really ahead from everyone. So that's basically the pragmatic approach, Rafa, that we do in order to make this realistic, because I understand your question is not just a checklist and going to the countries and asking for doing something. Yeah, that's the first question. I want to assure that's okay.
That's perfect. Thank you very much. I just don't want to hijack the meeting. Randy will pull my ears. So
She will.
And this,
She will. Just make the answer fast because I want to call on a few other people.
perfect. Yeah, and the second question is, I mean, there is a return on investment and value on investment. Financially, productivity, innovation, new products connect wherever your clients. I mean, it's clear that a financial company who have more women in their workforce and women with a more diverse background definitely will be developing products for financial women that are in the same situation. That's natural. But we have also the value on investment, which is how is your brand recognized in the markets? how do you connect with your sustainability reports and strategy, and how investor will see your consistency in your promise and then in your reality of women participation, women development. I think that there is another point that is interesting to see is women are less keen to be corrupt, and it is interesting that Colombia has one of the highest participation of women in the high talent level. And it's interesting that there are more jails for men than for women. So I think that we need to consider also another components that will be putting women leading in a different situation compared to men. I mean, you can read the books and you can read the statistics about that and criminal psychiatry. But the point is that, I mean, the opportunities are there. It's just a matter how the companies remove the bias and really see the executive leadership to get the commitment and get the investment. I mean, and I'm not saying that they need to invest everything in 1 year. They can do in 5 or 10 years according to the reality. But please do it. It's not just a matter of keep going, watching from your seat and see how you are losing your competitiveness as an organization.
Yeah,
thank you very much.
Yeah, I just want to add that, it's not, we obviously believe this is the right thing to do, and a lot of our clients do as well, but it's not an altruistic endeavor, right? They see that they're losing the war for talent if they don't do this.
Laura Beristain, you had some great chats. Do you want to ask a question? Yes, thank you. Your camera's on. Go.
So Randy, first of all, thank you all so much for sharing this. I am Mexican American, so I lived in Mexico, one of my pregnancies, the other one in the US. So believe me, I have seen both. And I think I put it on my chat. I really feel, and this is something that's very close to my heart, because I know many single parents, single moms. And honestly, what I see out there, it's just really sad. I know we keep saying we want to see more women in the workforce, and the pandemic has really kind of taken us back, but let's also be honest. And I know this is not just a private sector. I know a lot of companies are trying to develop these benefits, but it kind of also goes hand in hand with our government. And I think you mentioned that earlier. But I would love to see more of the private sector companies really influence some of the local governments and say, I mean, I live in Miami, Florida. I don't know if everybody's here, but you guys know childcare costs are ridiculous. I mean, I even think to myself, how can a single parent even afford to put their child in a childcare for them to go to work? It's kind of like, it's just, I don't know. I know this is not going to be solved today here, but I do see these disparities even in the US. It's we're in a first world country.
Yeah, you use a good example of the disparities here in the US. High deductible plans, the prevalence of high deductible plans are higher in low income employees. So the point is that when the employees need healthcare, they need to pay upfront the deductible that could be $4,000 or $5,000 in low income individuals. But employers need to work on that also to educate them and learn about the importance of thinking in risk. They are not experts in risk management, but they need to envision how they are managing their financial, because people say, no, I am young, I have nothing, I am okay. And I have seen a lot of stories of youth families getting in trouble because they high deductible plans, for example. This is just one example of the disparities and the opportunities to work under communication. Further than just, it's hard to change the system now, but probably helping individuals, empowering them with the right communication.
Mariya. I was just going to add, I think you pointed out something in the comments, Laura, and it's about the deductible, right? Or like the out-of-pocket expenses. I think a lot of employers, when they see that, especially when they start working with us and they see how much more is covered in the US than it is in some other countries, right? They decide that their US healthcare is just the best. And they don't necessarily think of those barriers to actually the access to care or like the decision-making to not get care based on the out-of-pocket expenses. So that's definitely probably the biggest issue in the US. Yeah.
And so we had one other comment. I don't think Amaya is still on, but she said eating disorders are a huge issue in the pandemic for women, and solutions from insurance are terrible. thank you for bringing that up. And this all has to do with resilience, and women have so much stress, and oftentimes we run for the refrigerator, calm down, and that just leads, as this app that I use all the time says, it sends you down into a different spiral of hell when
Yeah.
you do that.
It's that and the generational kind of trauma related to appearance that women get. Yeah.
Exactly. And so on that happy note, or not actually, Mariya and Diego, thank you so much for this marvelous presentation. It has given us an excellent roadmap and remind us that there are 4 things that are important, and now we can go back to our employers and start demanding. So
thank you so much.
Thank you so very much. We and with that, we've concluded our conversation, but we look forward to staying in touch and working with you more extensively. Thank you.
Wonderful.
Thank you all
Thank
for
you so
joining
much for
and for your
inviting us.
time.
Thank you everyone for
Thank you
joining.
very much. Thank you, Randy.
Bye, Rafa.